Scoliosis is a condition where the spine grows sideways, so that's this way.
Okay.
Lordosis and kyphosis are forwards and backwards. So the most common cause of scoliosis is a problem during puberty when kids grow, and that their spine, instead of growing straight, grows crooked. So it grows to the left or to the right. And the most common early sign is that when they bend forward, they are deformed or uneven. One of the problems with scoliosis is, like high blood pressure, is there are no symptoms. So most of the kids have no pain, and they develop it slowly. So it's a progressive disorder with absolutely no symptoms. So it's a silent disorder, just like a high blood pressure. So that's why you have a school screening program to try to pick those kids up. In terms of your scoliosis, because of the area of the spine is also the area of the chest, it starts to affect the other parts of your chest. So it starts to affect your heart and lungs, and it also affects your shoulder blades, and that's why people actually have a hump on their back. Growth is the key, so any person that is growing is going to progress. And if the curve gets significantly large, then it never stops. In terms of treatments, we will treat it with a brace. If the person is small curve, and then once it gets to be a large curve, then that's the surgery that we do. The pain and crookedness are the two major things that affect their day-to-day living. So if they don't have treatment, they walk around crooked, and they have pain with any activities. You have that spine mom and the brace. So the main non-surgical treatment for scoliosis is a brace. So this is a classic brace. It is a device that goes between the armpits and the waist, so it's a chest device, and it pushes on the curve, trying to hold the person and to try to A, correct it, and B, stop it. The brace is worn while you grow, and then when you're done growing, you stop the brace. If you have a small curve, it's worn at night, and if you have a very large curve, it's worn all day. This is a brace. In terms of surgery, the main surgery is called a spinal fusion, and what that does is it takes the spine and pushes it straight and then holds it straight so it can't change shape. And we use rods and screws to perform that surgery. The number one complication that you worry about with that surgery is a paralyzation or a paralyzed kid. So a kid can walk into the hospital and then leave in a wheelchair because you're changing the spinal cord. So we watch the spinal cord and make sure that the spinal cord's not damaged. The other complications is that you can have an infection, and you can also have your screws move or pop. In terms of restrictions and limitations, there is a time period between when the surgery is performed and when the fusion takes solid shape, and that's about 1 year. There will be restrictions and limitations on people. After a year, then there are no restrictions and there are no limitations. The back is meant to bend. The back is meant to not have a spinal fusion. So even though a spinal fusion helps the kids with scoliosis, it's not an operation anybody should ever have. So as our knowledge changes, hopefully we're going to develop some newer surgeries that will allow us to guide the growth. Instead of the growth causing the scoliosis to worsen, then the scoliosis will improve with growth, and then we won't have to do a fusion. Right now, from an anatomical study, we're still trying to learn how the spine grows. The spine has a front part and a back part, and how the front part grows and how the back part grows is very complicated, and we still don't understand it. The genetic testing is also a new knowledge that people will give a saliva or a spit sample, and they put a saliva sample in a cup, and then you run the test, and it'll tell you how severe their scoliosis is. And this is just at the beginning phases, and that's still in research. The growth of your curve is affected by growth hormone. So any child that receives growth hormone for other reasons will have an acceleration of the curve, or just naturally as you grow through your growth spurt.
All right.